आपकी बहुत बहुत आगे के साथ बहुत वेलकम।
और विश्व भर में ये एवरी सेकंड थर्सडे आपका सबका मैं हार्दिक अभिनंदन करता हूँ पहले नमस्कार करके। तो इस बार हर साल ये वर्ल्ड किडनी डे मनाया जाता है, जिसका मेन उद्देश्य सेकंड थर्सडे मार्च में विश्व भर में मनाया जाए, जिसका मेन उद्देश्य है टू स्प्रेड द अवेयरनेस ऑफ द किडनी डिजीज। हमें आप लोगों में जागरूकता लानी किडनी डिजीज फॉर द अर्ली डिटेक्शन ऑफ द किडनी डिजीज। Why it is important? Because kidney is a silent killer, number one, major silent killer, and this is a disease which is highly underdiagnosed and undertreated. आज 20th वर्ल्ड किडनी डे है, जिसका मेन उद्देश्य दो उद्देश्य हैं। आर योर किडनी ओके, आर दे फंक्शनिंग नॉर्मल। आप अपने आप से प्रश्न करिए कि मेरी ये किडनी क्या नॉर्मल काम कर रही है या नहीं। दूसरा, अर्ली डिटेक्शन एंड प्रॉम्प्ट ट्रीटमेंट। मोस्ट एसेंशियल पार्ट इन दिस इज अर्ली डिटेक्शन। यू मस्ट डिटेक्ट द डिजीज इन ए वेरी अर्ली स्टेज। अगर आप अपनी बीमारी को सबसे अर्ली स्टेज में डिटेक्ट कर लेते हैं, कई ऐसी बीमारियां जो मैं बताऊंगा जो संपूर्ण रूप से जिसका इलाज किया जा सकता है। अगर नहीं भी हो सकता, इट हेल्प्स अस इन प्रोटेक्टिंग योर किडनी बाय टेकिंग ऑल पॉसिबल मेजर्स। दैट इज वेरी इंपॉर्टेंट। अगर आपने अपनी बीमारी को अर्ली डिजीज में डिटेक्ट कर लिया, इट मीन्स मोर देन हाफ द बैटल इज वन। तो आप इसको ये समझिए कि आपका ये बोन है, आप अपनी डिजीज है, आपको कंट्रोल किए जाने में बहुत हेल्प करेगी। आप कुछ सालों से देख रहे होंगे कि किडनी डिजीज की संख्या बहुत तेजी से बढ़ रही है। सो मच सो इट इज assumed an epidemic proportion, महामारी का रूप धारण कर चुकी है। 1 out of every 10 person is affected by a kidney disease. In elderly age, 1 out of the 5 is affected by a kidney disease. So if you look for the burden of a kidney disease, वर्ल्ड ओवर में 850 मिलियन से भी ज्यादा गुर्दे रोग से ग्रस्त है, और हमारे कंट्री में 14 करोड़ से भी ज्यादा ये ग्रस्त है। एवरी ईयर वी आर एडिंग 2.5 lakhs of the patients who are requiring dialysis, और 80% of this disease occurs in the middle income group or low income group। इसके बाद इसका अगर हम इसका कारण ढूंढे, तो majority of the diseases are due to diabetes and hypertension। 75%. Every alternate diabetic patient is a victim of the kidney disease, and every 5th high blood pressure patient is a victim of the kidney disease। ये सोचा जाता है कि किडनी डिजीज मिडिल एज एंड एल्डरली एज है। मैक्सिमम इंसिडेंस इज सीन बिटवीन 45 to 69। आजकल इसका इंसिडेंस जो है यंगर एज में काफी देखा जा रहा है, इसका इंसिडेंस काफी बढ़ रहा है। इसका मुख्य कारण है जो यंगर जनरेशन है, they are physically inactive, they don't do regular exercises, they are taking lot of junk food, packed food and fast foods, जिसकी वजह से उनका वेट बढ़ जाता है। obesity is one of the major cause, and there is an epidemic of obesity। 1 out of every 8 patient is a victim, a person is a victim of the obesity, and obesity is the one which is the mother of the various diseases। जिनको ओबेसिटी हो गया, दिस मोर हाई रिस्क टू डेवलप हार्ट डिजीज, किडनी डिजीज, हाई ब्लड प्रेशर, कैंसर। तो आजकल किडनी के पेशेंट काफी ये ओबेस पेशेंट में देखे जा रहे हैं। सो यू शुड ऑलवेज से बिग नो टू दिस जंक फूड, फास्ट फूड, पैक्ड फूड। दैट इज एक्सट्रीमली इम्पोर्टेंट। अदर दूसरी मैं बताना चाहूँगा, आजकल यंग पेशेंट जो हम देखे जा रहे हैं कि जो लोग जिम करने जाते हैं, they are taking lot of muscle building protein। There is a fashion to build the muscles, and I have seen many patients recently, they are developing not only acute kidney injury, this muscle is the one high protein diet puts lot of load on the kidney, and it's injurious to the kidney and causing acute kidney injury, nephrotic syndrome, even chronic kidney disease also। So I want them not to take this patient, and they should be always in contact with the doctor before they take all these things। The third, for awareness, I'll say in a younger patient, the patient who are hypertensive, high blood pressure patient, 90% are there due to the kidney disease. All the young hypertension should not be just treated blindly. उनका किडनी डिजीज के बारे में पूरी तरह से जांच होनी चाहिए। जैसे मैंने पहले कहा है कि किडनी डिजीज होती हैं साइलेंट किलर है। Why it is so? It has been seen कि kidney symptoms only appears when more than 80% kidneys are already damaged. Even if the symptoms appear, they are usually very mild and overlooked. इसका क्या रीजन? मेन मैं सोचता हूँ कि किडनी डिजीज it does not cause any pain except the kidney stone disease. That is one basic reason can be there. और हमने ये रूटीन में देखा अपने जो गवर्नमेंट हॉस्पिटल्स में मेरे 80% जो पेशेंट्स हैं हमारे पास वो यूजली एडवांस किडनी फेलियर में ही आते हैं जब उनको स्टेज 4, स्टेज 5 एंड वी डॉक्टर्स एज सच कैन नॉट हेल्प मच and then only the treatment is dialysis and transplant. If the patient comes to in a very early stages, like the creatinine just started rising, and we evaluate if the underlying cause many times the kidney disease can be fully treated. For example, immune-mediated diseases, SLE or ANCA-induced vasculitis, like blood disease, multiple myeloma, or if there is a stone disease, we treat the stone. So you can completely cure. If we cannot cure also, we can certainly slow down the progression of the kidney disease. I'll tell you what is chronic kidney disease. Chronic kidney disease means there is some injury or damage to the kidney for more than 3 months. It is known as chronic kidney disease. Chronic kidney disease सबसे special characteristic क्या है? Once any person who develops a chronic kidney disease, he develops irreversible and progressive renal failure. इनका जो डिक्लाइन इन किडनी फंक्शन है वो स्लो होके विद इन फ्यू मंथ्स टू ईयर्स दे डेवलप अ नियर टोटल फेलियर जिसका सिर्फ उपचार है डायलिसिस या गुर्दा प्रत्यारोपण। ये ट्रीटमेंट बहुत कॉस्टली है। समटाइम आई से द किडनी डिजीज ऑफ रिच पर्सन, मोस्ट ऑफ द लो पीपल मिडिल इनकम दे कैन नॉट अफोर्ड दिस ट्रीटमेंट। तो जिसका खर्चा इतना ज्यादा था, प्रिवेंशन इज द ओनली आंसर। प्रिवेंशन इज ऑलवेज बेटर देन क्योर। वी शुड प्रिवेंट इट। लकीली इन लास्ट 1 decade, 10 साल 2014 के बाद, वी हैव हैड सो मेनी न्यू ड्रग्स व्हिच हैज कम अप, which has been discovered, which has totally revolutionized the treatment. It's totally game changer, and it is big paradigm shift. And most common drug which we are using, all of you know, is SGLT2 inhibitor, like empagliflozin, dapagliflozin, canagliflozin. You must have read in the newspaper 2 days ago, the rate of this empagliflozin has been reduced by 90%. So these are much cheaper drugs, which are both nephroprotective as well as renoprotective. हमारे किडनी के पेशेंट जो होते हैं, we lose 50% of this patient due to the heart disease, and 50% die of the heart rather than kidney disease. So by using this type of drug, you protect not only the kidney but also the heart. So these are very important. But as far as kidney disease is concerned, the diagnosis is extremely simple. Where just you do the blood test and urine test. The most important is you do the early sample urine. If you have evidence of albuminuria, which is the earliest sign of a kidney injury, and 24-hour urine albumin is very cumbersome, you just do the spot urine ACR. And if it's more than 30 milligram in ratio, it means your kidneys are damaged. It's a big warning sign. You start the active treatment. Other is blood test. You do the serum creatinine, and if it's more than 0.9 in female is abnormal, and if it's more than 1 point is abnormal. But creatinine is a very, very crude marker because it arises from the muscle. The person who is a frail, who is elderly patient, serum creatinine may be low, when actually he may be having kidney failure. So the best marker is glomerular filtration rate. It tells you what a filtration capacity of the kidney, with what rate is filtering out your waste products from the kidney into the urine. So everyone should know, ask, what is my GFR from the doctor? That is extremely important. So many equations are available nowadays, which is almost gives an accurate reading. which may be equal to near to the measured. If you use like CKD EPI 2021, where they are using cysteine C as well as the creatinine, if you use both the internal biomarker, we can know the true GFR. Now I am going to tell you very important two-step golden rule which you say to prevent the kidney disease, and everyone should adopt that, and you should protect your kidney. That's extremely important. Now number one is lifestyle modification. Secret is lifestyle modification. Everyone should do regular physical exercise. You should be very physically active. I say minimum 150 minutes per week. Rather, half an hour in a day is extremely important. If possible, they should do the yoga and meditation. That will also helpful. The other important is maintenance of the body weight. You should have a machine, weighing machine and blood pressure at your home. That is always better. And weighing machine, weight control is extremely important. अगर ज़्यादा weight होगा body का, it will put lot of load on the heart and the kidney. So controlling the body weight is important. Then about the diet, आप पौष्टिक आहार लीजिए. We should be very rich in fresh fruits and fresh vegetables, rich in dietary fibers, low salt, and preferably it should be plant-based proteins. Animal-based proteins, you produce a lot of acid, put a lot of the kidney. And if you are a smoker, kindly do not smoke. It has been seen the tobacco part causes vasoconstriction, narrowing, and your kidney disease if you are having, it will progress very fast. The big no to this one. Other important is if you are take plenty of fluids. At least 6 to 8 glass of water is extremely important. जितना पानी पिएंगे, आप अपनी बॉडी से जितने भी टॉक्सिन उत्पन्न हो रहे हैं, आप यूरिन के माध्यम से उसे बाहर निकाल दें. And it has been seen those who are taking a lot of fluids, the incidence of infection, urine infection is very low, and the incidence of stone disease is very high. If you ask a urologist colleague, the maximum cases of stone disease they are getting only in the summer season. So your body should be well hydrated. Other important is if you are smoking, do not smoke. Besides that, you do not take alternate medicines, homeopathy, Ayurvedic medicine, or muscle building protein, which I have mentioned. They are extremely, all the painkillers especially. Without the consultation doctor, you should not take the drugs. And from this, from the chemist, you buy all this is a very injurious to the patient. And you must check the blood pressure. If you are high blood pressure patient, the level should be individualized. In the younger person, if the BP you have to maintain 24 hours, not only morning, evening, 120/70. If you maintain that 120/70, so you can prevent all the complications arising due to the hypertension. There are so many studies are available, and in elderly age patient, it should be around 140/80. And if you are a diabetic, early stage strict control of the blood sugar is extremely important. Maintain HbA1c of 6.5 to 7, and 24-hour sugar should be well controlled. And other important is those who have already developed kidney disease, you should not have a very strict control because they are very high risk for the hypoglycemia. And blood sugar fasting should be around 120/30, and post-prandial should be around 160 to 180. You can be afford to be little liberal. The other important, those who are high risk to develop a kidney diseases, especially those who are non-diabetic, hypertension, or who are obese, family history of kidney disease, age above 50, or who had a past history of acute kidney injury. They are the one annual check-up is extremely important. It doesn't cost much. Do the urine test and do the kidney protein test. There are two simple tests required for the early death. There was one survey which going on in the general public, only 6% and those in high risk groups, only 10%, they know what a kidney function is. Because in RML I use so many VVIP used to come, they will have blood sugar and all, they never got albumin checkup and all. And I have seen many patients in my experience, they have been playing very active throughout their life, and next week they come, they are in end stage, they are diabetic, all everything come out. And most of the time these diseases are detected like they are going for annual checkup, insurance checkup, or pre-operative checkup. Routinely, they come with a very high creatinine now. So you have to. So to conclude that, I'll say there is a huge epidemic of the kidney disease. That is number one. Number two, early detection is extremely important. If you detect early, you can cure the disease and you can prevent. And these are newer medicines which are available. You can delay the requirement of dialysis by decades, and they have projected it will be more than 18 years. So they are game changer, and you must use all the patients. In your group, take the advantage, you can slow down. Thank you very much.